Hello and welcome to our latest video interview. Today we are talking about wheelchairs together with the Kent Physical Disability Forum and other disability groups. We've been working to improve the wheelchair service in Kent and Medway. Now we've invited Tamsin, Flint, to join us today so we can hear about the latest improvements to the service. Welcome, Tamsin.
Hello, Phil. Thanks for having me.
We've been working with you for, I think it's maybe 2 or more years now on the wheelchair service, but our listeners and viewers won't know what you actually do. Can you tell us who you are and what you do every day?
Yes, of course. My name is Tamsin Flint. I work for the Kent and Medway Clinical Commissioning Group, and I'm the commissioning manager for the wheelchair service across Kent and Medway. What that involves is monitoring the performance of the wheelchair service and working closely with the provider to ensure the service is managed effectively. It's about talking with CCG colleagues and other stakeholders and organisations at a local, regional and national level to provide information, share knowledge and expertise, and to facilitate more joined up working so we can drive further improvements in the service. And also it's about listening to the people who actually use our service and finding out from their experiences what's working well, areas that aren't working quite so well, and how we can design and develop a service that really meets the needs of service users now and for the future.
We're going to focus today on wheelchair service. We first came to you as an organisation back in 2019 to share stories that we'd been hearing from people who used the wheelchair service. Do you remember some of those stories?
I do, and I'm really pleased and grateful that people did come forward and took the time to share their experiences. It really helped to highlight issues which we could then start to address to improve the service. As you and your colleagues at Healthwatch probably remember, we met regularly to review the feedback received, identify themes and trends, and really discuss what that meant to the service, what changes were needed based on that feedback. Because your feedback was telling us that, and feedback from others was that people were waiting unacceptably long waits to get an assessment, to wait for their wheelchair and equipment, and even to get repairs completed. And you also told us about service users experiencing poor communication and really struggling to get updates around when they would receive their wheelchairs. So understandably, many service users and family members were really unhappy and very frustrated with the service.
So since then, we've all been working together to kind of improve the wheelchair service. Can you tell us, what's changed since then?
Yes, a lot has changed since 2019, and I'm pleased to say there has been steady and significant improvement in the performance and quality of the service. But that's thanks to, like I said, service users sharing their experiences, us talking to them, working with yourselves and others, developing a service improvement plan, having a strong team in place at Millbrook Healthcare, the provider of the service, with improved processes and more clinical and support staff, and also additional funding from the CCG. And all that's resulted in service users having significantly shorter waits for their wheelchair. There's also been considerable improvement in the time service users are waiting to get repairs completed. Communication has been a key area that we've been focusing on internally to make sure that feedback was being shared with the staff within the service, but also being a lot more proactive with communication with service users. And there's also been a reduction in complaints and actually a lot more positive feedback being received by the service, and the whole process and the time taken to review and respond to complaints has improved. And lastly, and really importantly, is Millbrook have really recognised the value of hearing directly and talking directly with service users, and they've held a number of engagement events to meet service users face to face, to hear about their stories, their experiences, and to gather feedback around where they could improve. And they've also established a service improvement board, which has a number of service users on board as members of that group.
One of the positives is that you've now got a wheelchair user actually employed by the service. Can you let us know how that has actually helped it to improve?
Yeah, this was actually something that was raised in a service user group meeting that we had back in 2018, 2019, and Milbert really embraced this idea and have recognised the value in this, not just in Kent and Medway, but also across the organisation in terms of employing people with lived experience. And in Kent and Medway, we've now, or the service has now employed a community liaison and engagement officer, Clive Bassant, and he is a wheelchair user himself, and he's also got vast experience liaising and engaging with others communities. And he's made such a huge difference, positive difference to the service. He's able to bring that insight of lived experience to help support the wheelchair service staff, but also service users. I recall Clive telling me about a young gentleman who was very anxious about moving from a manual to a powered wheelchair. And Clive was able to talk to him face to face, talk about his worries, his anxieties, and actually try and highlight his own experience and the benefits of a powered wheelchair. And actually he made what was initially quite a negative experience into something that was really positive, and the service user came away feeling really, really upbeat and quite happy.
Oh, excellent. We're not very good at blowing our trumpet, but do you think our involvement and that of the many voluntary groups and forums has actually been helpful?
Absolutely. I mean, Health Watch, the Kent Physical Disability Forum, the Centre for Independent Living, and there are many other organisations and individuals who have all played a key role in promoting the voice of service users and sharing their stories with us. I mean, yourselves, Health Watch, have been a key player in that and a key partner. You raised issues to HOSC, you helped raise the profile of the issues, and that's really helped to drive through those changes. And I'm really grateful for everyone who's worked in partnership with us, because we've actually made a difference. And actually it goes on. We continue to work with you and want to hear the voice of service users too, so that we can keep on making those changes.
Yeah, we're not going to rest on our laurels with it. What's next on the list to be improved?
Well, there's always work to be done. I'm really pleased with progress made, but my focus is on the future and exploring how we can improve the service further, so that we really meet the needs of service users, not just now, but for the future. And that really needs everybody's feedback. And I am going to be working with yourselves at Health Watch and other organisations to reach out to service users so we can gather their feedback, and then we can start designing a service that really meets their needs.
So how can wheelchair users and their carers get involved?
There are lots of ways that service users, family members and carers can get involved, and actually I really urge them to do so because their feedback's essential. Firstly, they can feedback on any experiences they have with the wheelchair, so any interaction they have, whether that's attending an assessment in the clinic or having a repair done. Or they can ask to become a member of the Service Improvement Board that meets on a quarterly basis. They can get involved in engagement events, which I mentioned just briefly earlier, and giving their feedback that way. Or they can simply contact the wheelchair service or the CCG directly via websites and provide their feedback that way.
Is there anything you'd like to specifically say to wheelchair users in Kent and Medway?
A big thank you sums it up, really. Thank you for taking the time to give your feedback and sharing stories. Thank you for their patience, and thank you for the ongoing support and input, because we need you to design the service you need, and together we can continue to make a real difference.
Tamsin, thank you so much for joining us. It's been really good to kind of take a minute to reflect on what we've all achieved together. And I want to say a big thank you to everyone who came to share their story with us, and of course the Kent Physical Disability Forum and the many other organisations and groups that have come together to make this happen. Your feedback, as Tamsin said, has made a huge difference to hundreds of other wheelchair users across Kent and Medway. So thank you. Tamsin, again, thank you for your time today.
Thank you.